If you have sickle cell disease, the transition from pediatric to adult-centered care isn't an easy one, but it's an important milestone and an exciting time in your life. It means you're becoming more independent about your own health and the way you manage your sickle cell disease. When you make that transition, you will start to see an adult hematologist for your sickle cell care. It also means that when you have urgent medical needs, you'll need to go to the adult emergency department rather than one just for kids. Before you make this transition, the Comprehensive Sickle Cell Program at Lurie Children wants to make sure you know how to navigate an adult emergency department so that you receive the best care possible when you have an emergency. Once you have transitioned, talk to your new adult hematologist to find out where you should go for emergency care. In the event that you need to visit an adult emergency department, it's important that you understand how to be an advocate for yourself. Being your own advocate means you know what you need, and you can tell emergency department staff what those needs are. You can be prepared by knowing your medical history, knowing how to describe your symptoms, as well as knowing what pain medicines and what doses usually work for you. For example, if you're going to the emergency department for pain that can't be controlled at home, you should know the name and dose of pain medicine you took at home, in addition to knowing what time you last took the medicine. Knowing all of this will help you work with the emergency department staff to get the best care possible. And also, be sure to bring your insurance card with you when you go to the emergency department. Now let's see some examples of how being prepared and knowing how to advocate for yourself can make a difference when you need to visit the emergency department. In the first example, Carl is having a pain episode and his pain medicine at home isn't helping. Carl decides he needs to go to the emergency department to get his pain under control. This will be the first time he's ever had to go to an adult emergency department, and he's just not prepared to advocate for himself. Let's see what happens.
Hi, Carl.
Yeah.
Hi. My name's Dr. Roberts. I'm one of the physicians here in the emergency department. I understand you're having some pain due to your sickle cell disease, is that right?
Yes.
Okay, well, we're going to get you something for that pain, but first I have to ask you a couple of questions. What type of sickle cell disease do you have?
I have SS.
Okay. What, if any, complications have you had in the past due to your sickle cell disease?
Mostly pain,
Okay.
but I've had acute chest syndrome before.
Okay, do you see a hematologist for your sickle cell disease?
Yes, but I don't remember her name right now.
Well, that's okay. Do you have any allergies to any medication?
I don't think so.
Okay, what medications are you currently taking?
Just pain medicine.
Right, do you know the name of your pain medication?
I don't know. It's just what my doctor gave me.
Okay, did you take any of your pain medication before you came here today?
Yes.
Okay, what dose?
I took one pill. I don't remember the dose.
Okay, well, how long ago did you take it?
Like 3 or 4 hours ago. I don't really remember. Can I just get something for my pain now?
Well, we're going to get you something in a minute. Just a few more questions. Where is the pain you're experiencing?
My back.
Okay, how would you rate your pain from a scale from 1 to 10, 10 being the most pain you've ever been in?
8.
Great, we're almost done. Have you been admitted to the emergency department or to the hospital before for your pain?
Yes. I don't know. Can't you just check it on your computer?
Well, since you've never been to this hospital before, we don't have your medical information on file, so I can't look it up. Do you have any idea what pain medication normally works for you?
Whatever they gave me at the children's hospital worked, but I don't know the name. I just want something for my pain.
Right, we are going to get you something for your pain, but since you don't remember what kind of medication you normally take and what you took earlier, I'm going to have to start you on a lower dose. I'm going to go order it, and the nurse will bring it in when it's done, okay? Hi, Carl. Is the pain medication helping at all?
No.
Was the medication helping at all? How would you rate your pain now?
I don't know. It seems to not be working. I just want something more.
Okay, well, we'll try some more medication in a bit. If we can get your pain under control, you can go home. Otherwise, we may have to admit you to the hospital. Either way, you're going to want to see your hematologist for a follow-up appointment after you leave here.
I don't know how to do that. Can't you just call and make an appointment for me?
You will have to call your hematologist to make an appointment. I cannot do that for you.
Fine. I just want something more now.
Okay, well, I'm going to order you another dose of pain medication. I'll put in the order. The nurse will bring it in when it's ready.
Carl was not prepared for his visit to an adult emergency department and was not able to advocate for himself. As a result, Carl and the doctor who saw him both became frustrated and were not able to get his pain under control in the best and most efficient way possible. Carl should have known the name and the dose of the pain medicine that he was prescribed to take at home. He should have also known what time he last took his medicine at home and how much he took before coming to the emergency department. Because Carl didn't rate his pain or describe it after the first dose of pain medicine, it was difficult for the doctor to determine if they were using the right medicine for Carl. It is also very important that Carl knows how to make a follow-up appointment with his hematologist after he is discharged. Now let's see an example of what happens when you're prepared and know how to advocate for yourself. In the next example, Chris has recently transferred to an adult hematologist and he's having a pain episode. His pain medicine at home is not helping, so he decides to go to the adult emergency department for the first time. Let's see what happens.
Hi, Chris. Hi, I'm Dr. Roberts. I'm one of the physicians here at the emergency department. What brings you in?
I have sickle cell disease. I'm having a pain episode. I took my medication like my hematologist told me to, but it's not helping.
Okay, well, we'll get you something to deal with that pain. But first I have to ask you a few questions. Can you tell me what type of sickle cell disease you have?
I have SS.
Okay. What medications do you currently take?
I take HU and Percocet for pain as needed. Here, I have them with me.
Oh, great, thank you. You said you took your pain medication at home before you came here. How much did you take, and do you know what time you took it at?
I took 2 tablets at 2 p.m. and then another 2 tablets at 6 p.m. Each tablet is 5 milligrams.
Good, good. Where's your pain located?
My back and my chest is typically where my pain is.
Okay, and how would you rate your pain on a scale from 1 to 10, 10 being the most pain you've ever felt?
I would give it about an 8, which is where it mostly is when I have to come to the emergency department.
Okay, well, I think we'll have you try IV morphine for your pain.
Actually, that doesn't work for me. I normally take IV Dilaudid, which works best for me. The doctors normally start me off with 1 milligram, but I think I need 2 milligrams to start. If you want, you can call my hematologist for more information. I have the card right here. Okay,
great. That's helpful for me to know. I'm going to order you IV Dilaudid instead, since that's what's worked for you in the past. I'll put in the order right now and have the nurse bring it in right away. Is there anything else I can do for you right now?
No, thank you.
Okay. Hi, Chris. How is your pain doing now? Is the medicine working at all?
It's feeling a little bit better, but I'm still experiencing a lot of pain in my back. I was wondering if I could get another dose, if I can.
Yeah, I'm sorry to hear you're still having so much pain. What would you rate that pain at now?
I would still give it an 8 out of 10.
What number would you like to get your pain at before we think about sending you home?
Well, typically, if I can't get it at about less than a 3 or a 4, then I am admitted, but I was wondering if I can get another dose, if I can.
Yeah, no, that sounds like a good plan to me. I will order you another dose of Dilaudid. If we can't get it under control with another dose or 2, we will talk about having you admitted. Whether or not we admit you, though, you should make a follow-up appointment with your hematologist after you're discharged.
Okay, I'll make a follow-up appointment with my hematologist.
Yeah, great. Okay, I'll go order you your next dose of pain medicine and have the nurse bring it in as soon as it's ready. I'll be back to check on you in just a bit. If you need anything, have the nurse page me.
Okay, thank you.
Yeah.
This time, Chris was well prepared for his visits to the emergency department, and he did a great job advocating for himself. As a result, both Chris and the provider were able to remain calm and work together to get Chris's pain under control as fast as possible. Chris knew exactly what pain medicine he had taken at home, how much he had taken, and when he last took it. He also knew which pain medicines work for him and which ones don't. This helped the provider know exactly what to give Chris to take care of his pain as quickly as possible. Finally, Chris was able to communicate how much pain he was having and what level of pain he was comfortable going home with. This allowed Chris and the provider to come up with a plan together that they were both happy with. All of this helped the emergency department give Chris the best care possible. Knowing how to navigate the adult emergency department will help you be as prepared as possible for a smooth transition from pediatric to adult-centered care. Once you have transitioned, it's important that you discuss your plan for adult emergency care at your first visit with your adult hematologist so that you know where to go and what to do before you have urgent medical needs. In the event that you do have urgent medical needs after transitioning to adult-centered care, we hope that these examples have helped prepare you to navigate an adult emergency department. From all of us at Lurie Children's Comprehensive Sickle Cell Program, we hope to make your transition a successful one.